Hi there, Jody here for week 6, and I just had an interesting week. So never seen before diagnosis. I've seen this diagnosis in plenty of patients, but I've never had to deal with this before, I guess. Which is funny because we just talked about this in the seminar that I just watched for seminar 6. So I had a nurse practitioner who was let go before me, and this was actually in my practice, so family practice, which is even crazier, and I am gonna probably make a soap note on it. She only had one test for ADHD. She'd never been to psych. She'd never been seen by a psychologist. She's was on 120 benzos a month, 120 Adderall, I believe. I can't remember the number, a month. But the nurse practitioner before me was a family nurse practitioner, acute care, and I personally did not feel comfortable giving her these medications together. Not only did she have heart issues, she had high blood pressure, she had, her heart rate at one point was 152. She'd only been tested once in the office for ADHD. There's never been a drug test, and there's so many on board that I didn't even know what to say. So I think the case had an effect on me because she not only did she complain about me because I didn't give her the medications. I sent her to psych instead because I didn't feel comfortable. And this was because I was in family practice, but I think it's relevant to talk about because we are doing psych, and I knew the rules, and I knew even by listening to the lecture today, I didn't feel comfortable. And she reported me to the board because I wouldn't give her the medications. I don't think, I didn't have enough information on her. This is the first time I ever saw her. And I really didn't feel comfortable giving this patient these medications. I didn't feel like she had proper testing. I didn't feel like this was healthy. And I personally would never give those medications. So this was someone before me who had been let go. And the psychopathy behind it with the patient provider, she didn't really say a whole lot to me during the appointment because I only had 15 minutes with her. But then she just went crazy after, and I'm still, well, I probably shouldn't talk about it, but I'm going to have to respond soon. I don't think it'll go anywhere. But my personal strengths, I'm not going to do that. And I feel like that's a boundary for me. My limitations were I knew that was out of my scope of practice, and I'm not going to do that. With our provider-patient relationship, I almost feel like that I don't want a patient like that. I don't want someone seeking from me, and I don't want to give them that many medications. They're two completely different medications. They do two completely different things. And I was completely shocked by the fact that she had been getting these medications and so many of them. So, reflection and therapeutic use of self. Well, to say the least, I'm definitely disappointed, but I don't think I did the wrong thing. I do think I did the right thing by the patient for myself. My insights and learning, well, I mean, just watching the lecture today, if you don't feel comfortable, don't do it. I think it's completely out of my scope. And I don't think that they were prescribed correctly. So I think that I did the right thing. The interaction, I feel like I really interacted with the patient appropriately just by, I sent her to psych. I sent her somewhere else to get more evaluation because I didn't feel comfortable. I do feel like I did the right thing, and after watching the video tonight about this kind of behavior lingering, I feel like I did the right thing. So, a very uncomfortable situation right now, but I still feel like I did the right thing. And I don't think, at least I hope, a board is not going to look like I did the wrong thing based on the fact that the patient was giving medications before me that I didn't feel comfortable with. I've never encountered someone who was taking Adderall and benzos at the same time, and so many. So I don't think the patient was taking all of these on her own. That's just my opinion. I don't know for sure. Obviously, I would never put names out, but it's a real life thing. So have a good night. Thanks. Bye-bye.